Welcome back now. Hand hygiene remains the most effective measure to prevent healthcare-associated infections, antimicrobial resistance, and disease outbreaks. In recognition of its importance, the World Health Organization, WHO, launched the World Hand Hygiene Day back in 2009. The date is now observed annually on the 5th of May. In alignment with this global initiative, the Ministry of Health and Social Services is committed to strengthening hand hygiene best practices across Namibia's healthcare facilities, and the 2025 World Hand Hygiene Day is being commemorated under the theme, "It might be gloves, it is always hand hygiene," which emphasizes the gloves that do not replace proper hand hygiene. Now, with more details on this global initiative, I'm joined in studio by Shihepo, a senior registered nurse of infection prevention and control specialist at the Ministry of Health and Social Services, also accompanied by Loide Tashiya, who is also a senior registered nurse of the infection prevention and control specialist at the Ministry of Health and Social Services. Ladies, good morning, and thank you so much for making time to speak to us this morning.
Good morning, and thank you also for having
First
us.
questions first. Where are the male registered nurses, senior registered nurses?
They are there. They will be here. It's just a matter of time.
Just a matter of time?
Yes.
Okay. Perhaps maybe, Ellen, let me start with you. Maybe just explain to us briefly as to what World Hand Hygiene actually is all about, and perhaps why the WHO saw it fit to establish it and why Namibia commemorates it annually.
The World Hand Hygiene was launched in 2009 with the theme of Save Life and clean your hands. So this was the WHO seen fit, and also as Namibia, we joined them in celebrating, because as cleaning your hands are the first that you use to touch anything. And we get to move bacteria with our hands. And we want to raise awareness, or WHO also want to raise awareness in this by, in the antimicrobial resistance, to avoid us spreading and getting the bacteria resistant to any medication, any cleaning agent. So Namibia and WHO has joined in hands so that we can raise awareness in this, and the ministry to join and to reduce the resistance in the community and in the healthcare facility.
Okay. Now, perhaps maybe, Loide, we talked about in terms of when we're doing the introduction, the theme for this year, we know that is commemorated on the 5th annually, but yesterday we know it was a public holiday. The theme for this year being, "It might be gloves, it's always hygiene." In terms of a health practitioner's point of view, and from a health practice in terms of context, are you able to break down what that means? Because one would assume that, wearing gloves, it's a safe thing to be wearing gloves, and there's no threats to that. But now you're saying it's not the situation.
Indeed, indeed. You are correct, because the theme actually highlighted that even if you are using gloves, you still need to wash your hands. Yeah, because most of our hospital-acquired infections, and then our infectious resistant bacteria, they occur when we are not washing our hands, because the hands are mostly the ones that are transporting these bacteria. Yeah, so it's very important for us to make sure that we wash our hands before putting on gloves and after putting on gloves, for as long as it's accordance with the 5 moments of hand hygiene that we are currently now working together as the world is also commemorating this day.
Okay. When you talk about 5 moments of hygiene, what are those?
The 5 moments of hand hygiene, there are actually a lot of moments, but WHO tried to make it easy for us and tell them to be 5, which is before touching the patient, before any procedure, after touching the patient, after all the aseptic procedure when you are done with us. Let me say you were dressing a wound and so forth. And then after the patient surrounding, when you are leaving the patient, you have to make sure that you also wash your hands.
Okay. Now, Madam Shihepo, for those that might be watching, in this word that you keep mentioning, that is antimicrobial resistance, what is that? What kind of disease that is so resistant? What are the examples of those diseases?
If I take us back, remember COVID?
Yes.
it comes with different names. That is when a bacteria mutate, change its shape. That what you were using before to kill me, it's no longer working. So I'll change myself so that what you were using, if you were hitting me on the head and I change, now you're using this. So I'm protecting myself. That is what, when we say resistant, that what you are using, it's no longer working on that bacteria. Yes.
Now, why is hand hygiene specifically considered to be the most effective when it comes measuring preventing healthcare-associated infections and the spread of this antimicrobial resistance? Why is it the most effective? I mean, some people could be saying there could be other alternatives. Why does it appear to be the most effective?
80% of bacteria, you can be able to clear them with hand hygiene. There is other way. Remember, we wear mask, protective clothes, but hand hygiene we transmit because you touch a patient by touching them with your hands. You move to a patient or assisting them with your hands. Also at home, when we eat, we prepare our food with our hands. So the hand hygiene is more effective because you wash the bacteria off that you have picked either on the surface from your environment or where it was. So when you wash it off, you have reduced by 80%, according to WHO. And that is more effective because the 20% you can wear a mask depending on what kind of the bacteria you are going to. But if you can remove a large quantity of bacteria, they are more on hands, on surfaces, rather than on airborne, on droplets. But this one on hand hygiene is more effective because it caters from the most. Yes.
Okay. Now, Madam Loide, many people assume that wearing gloves is enough. We talked about this, but one would still be thinking, if I'm wearing gloves and I'm cleaning or wherever it is, that it appears to be safe and that is it. Why do I still need to do more?
Yes, indeed. What happened is the gloves can still be contaminated just the same way as your own bare hands. So, we all know that if it can either be contaminated when you are doing a procedure by them being break, and then the germs and the bacteria can enter you without you knowing, or from the factory where they are coming from. They probably not every, remember, these are the man-made products. So they can come in different shapes, and some have a little bit hole, you won't see them. And remember, the bacteria are too tiny. They can enter in every possible way they can. So as long as we can wash our hand before putting on the gloves, just to remove the 80% that Ellen have mentioned here, and then also after, it will help us to eliminate the bacteria. Yeah.
Ellen, let's talk about what the Ministry of Health and Social Services is doing in terms of implementing this global initiative here in Namibia, not just in Windhoek, but across all the health facilities countrywide.
The ministry have called that all the facilities, all the healthcare facility to join. The hand hygiene is incorporated in the IPC strategy, in the infection prevention and control strategy, that we all join in commemorating this day and raising awareness in the hospital, being teaching the community, the healthcare workers, reminding them, the healthcare workers reminding actually, the community also to just teach them and raise awareness among them that hand hygiene is very important, and patients and staff in the hospital, as they enter in the hospital, that you don't leave without, there's posters everywhere, especially in the hospitals, and we are urging that as we enter in the hospital settings, please let's read them. Let's see what they are telling us. And as we are here today, also to raise that awareness, it's from the ministry, and we want to join hands together with the community, patients and visitors as they enter the hospital.
Okay. Now, Madam Tashiya, what are some of these challenges that you observed in enforcing this proper hand hygiene at your health, especially among healthcare practitioners or generally across your health facilities countrywide?
Okay. We look at the patient load there. We have a high number or turn-up of patients now. As we all know that we are growing. So in the healthcare workers, we are not allowed. Patient to staff ratio is not enough. So this can also hinder the hand hygiene compliance in the facility. And then also the lack of reporting when it's coming to the monitoring of hand hygiene in the facility. So we are supposed to report this compliance in time at the national level so that the ministry can see what they can do to help us that are on the ground. But you find there are some technologies, issues of reporting, the internet, the what. So yeah, it goes on like that. But we realize that when you don't report on time, it also hinder or challenge the ministry to see how we can meet you halfway. Yeah.
Madam Ellen, let's talk about, you mentioned earlier the issue of raising awareness, but what specifically is the ministry doing to ensure that the general public, understand the importance of hand hygiene? Very important. I know perhaps maybe during COVID, when we normally have those family meetings, which were managed by the late Dr. Ginkop as well as the former minister, Dr. Kalumbi Shangula, the issue of hand hygiene became, it became a song literally in our lives, in our daily lives, for almost close to 2 years. But what else are we doing besides COVID-19 to talk about the importance of hand hygiene?
Currently, we have urged that the healthcare workers, when patients enter in the hospital, before we start anything, they're supposed to do an educational. And that educational, we don't want it to stop at the hospital. We want it to continue at home. So when people talk about washing your hands at the hospital, I teach you how to do it, what they're supposed to do, and we must also read on about it. But the ministry is engaging that in different, at the clinic, district hospital, and the nationals, that everyone, whoever enter in the hospital, must able to hear when the nurse or the doctor is talking about the hand hygiene. And when we go home, let's also continue. And NBC has joined us today that please continue educating our community so that they understand. And we must talk about it at home. The hand hygiene, it doesn't only end in the hospital. It starts from home before you enter it in the hospital. Whatever you are doing, preparing your food, eating, as we know, before the toilet, after the toilet, before you start eating your food, you're supposed to wash your hands. And we want that to continue in the community, and we want us to teach our children, the school goers, so that they understand that it's important for us to wash our hands, that I must not eat without washing my hands. After playing outside, I must go and wash my hands. The ministry urged us so that we can engage in this of washing our hands. And we must remember COVID, people were putting on gloves, which was not, it was not a good thing to do, because it did not replace a hand hygiene. Yes, so we must still continue that we wash our hands. That message from COVID, let it come back. Let us go back into that moment of always wanting to wash our hands, to use the alcohol hand rub all the time.
Good. Now, as we conclude our conversation, perhaps let me start with you, Madam Loide. As an infection prevention control specialist, what message would you want to leave with Namibians, specifically regarding the significance of hand hygiene and saving lives? Most of us, as Madam Ellen just alluded now, that let's perhaps go back to the way that we're doing it during COVID-19. Is that a similar message you want to leave with them, or you want to give them a scary scenario so that maybe they will listen?
No, in this case, because we are here for awareness, it's just to inform the community that hand hygiene is not a professional task, yeah? This is a personal choice. So which means that, just like what my colleague here said, Ellen, you need to do it at home. We can only save lives if we clean our hands from here, at home, wherever we are, and then meet the ministry halfway. Yeah.
Okay. Madam Ellen, any final remarks from you?
Let's join hands, and by keeping them clean, let's save lives in Namibia by making sure our hands are clean. let it become part of us. It must become our habit. You see, we all have a family member that want everything to be clean. It shouldn't be only the surface, also our hands must be clean.
Oh, that's right, it must be clean. Ladies, thank you so much for making time to speak to us this morning.
Thank you so much for having us.
Now, that was Ellen Shihepo as well as Loide Tashiya, both are senior registered nurses of the Infection Prevention and Control Specialists at the Ministry of Health and Social Services, talking to us about hand hygiene. Now, they're also talking to the fact that the World Health Organization launched, that's the World Hand Hygiene Day back in 2009. And now it is observed annually on the 5th of May. This year's theme in terms of World Hand Hygiene is commemorated under the theme, "It might be gloves, it's always hand hygiene," which emphasizes that gloves do not replace proper hand hygiene, also indicating that hand hygiene is not a professional task, but it's a personal responsibility. Let's meet the ministry halfway to ensure, just as we were ensuring that our hands were clean, we washed our hands during COVID-19, it's the same thing that we should continue to do. Now, that concludes this interview. When we get to return back, we get to come back with more conversations.